Well, I'm Beth Bordeaux. I am co-owner with Partners for Impact and here with my partner, Stan Holt. Um, we've been working together for several years now. I don't know. It's been 20. It's been at least 20.
It
And
has at least 20.
we started working together when I was an executive director of a family shelter in Wake County. And you
Yep.
worked at United Way.
So we've been doing this homeless work together for a long time. And at least when I heard it, when you heard it, this executive order that was issued by the administration, we were both like, holy cow, what's this about? And that's, I think, what prompted this conversation that we're going to have. I don't know that we were thinking about having it be a newsletter, but we rethought that and thought, let's just have a conversation about this. And let's use it as an opportunity to kind of dig into it and understand the executive order. So as we kind of talk about this together, it is a structure, sort of, so to speak. We're going to, you're going to introduce kind of the executive order, Beth, and then we're just going to talk about it from here on out.
Right. So
you good with that?
Yeah. Let's move into that. So this particular executive order, it was focusing specifically around homelessness and issues of vagrancy, disorder, and public safety is the way it was framed. And the central things that it claims are that homelessness is a record high, and that's true, right? We've got data that shows homelessness is absolutely at a record high. But it also claims that it's caused by drug addiction and mental health issues. We're going to talk about that. It says that the current programs have failed and wasted money and are not addressing the causes. It says that the solution is to restore public order by moving homeless people into long-term institutional treatment via civil commitment. And this is
I want to define civil commitment.
Okay.
Because what civil commitment means is that is actually the involuntary, right? Involuntary is the word, confinement to a treatment facility. And largely it's a phrase that's used in the mental health world, right? But it's definitely involuntary confinement is the definition of it.
And it's actually based on someone being a harm to themselves or to others. And that's like the litmus test that currently has to be passed in order to have an order to allow that person to be, you have to go through the magistrate's office to get an order for civil commitment. And they have to prove that they have to have an assessment that proves that they are of harm to themselves or to others.
And what's interesting in the executive order, however, is that this phrase of civil commitment is presented as a compassionate response for people who are experiencing homelessness. And I think that's an important factor in how that concept of civil commitment is portrayed in the executive order.
So the order also prioritizes grants to states and cities with specific public policies that are intended to enforce these prohibitions and on open illicit drug use, urban camping, and loitering. Right. So they're going to push money out to people and states that will lock people up for being outside. It ends harm reduction and it ends housing first approaches, which we know are proven approaches. It's actually replacing them with what they say are evidence-based by actually ignoring that harm reduction and Housing First are already evidence-based programs. But it's
And we'll talk about that some more later because I went and pulled some data.
Okay, good. But it's refocusing the attention on substance abuse treatment and mental health treatment. And then finally, the order authorized data collection on health-related issues to be shared with law enforcement. Data that's collected on health to be shared with law enforcement.
So every time we went in and go into the doctor and sign that HIPAA agreement, where our data is not to be shared, this executive order reverses that to some degree to the people that this executive order applies to. They don't have that same control, if you will, over decisions about their data. That's that's kind of the executive order. And Beth, you and I actually took this kind of conversation to our consulting team, and we started thinking about, what's the alternative narrative? What's the story that we really need to begin to share? And that's the first thing I want to remind people that might be listening to this, which is the stories that we really need to tell, that we really need to tell those stories, and we really need to listen to those stories, because those stories really do challenge kind of the narrative that this executive order is based on. So making sure that we're telling the stories that we as providers have experienced about the people that we've served, the ways in which the system has really been responsible for their situation and not their own personal failings. All those stories are really important for any of us who are in this world of service provision to tell. And that's what I would really say. That's kind of the first call to action, is tell our stories on every social media place, right? Just tell our stories of what we've experienced in this sector. That's the first thing I would just say. That's an easy thing for all of us to do, that counter this narrative.
Absolutely. And, when you say that, my head starts flooding with stories. Because doing this work for a long time, I've met a lot of people. And I just want to give one quick one right now. And because this was really recent, and I started feeling like I'm doing this work now at the systems level, and I'm not as close to the folks who are most affected by decisions that are being made and things that are changing, right? So I wanted to make a connection. I was in Fayetteville one day, just driving through. I was at the gas station, stopped at the gas station, and there was a gentleman that was sitting down in the grass next to the gas station, and he had his belongings right next to him. So I thought, I'm going to go see if he'd be willing to chat with me for a minute. So I walked over and I asked him if he'd be willing to chat. And he said he would. He said he was okay, yes. And would I join him? And I said, sure. So I sat on the ground next to him and we talked for a little bit. And he told me a lot about what's going on with him in his life. He hasn't been able to find shelter. There's no room. The shelters in Fayetteville are full. And they're having a shortage of places for people to stay. And he talked about safety, right? So a lot of times and this order definitely takes the stance of public safety. And when you read it, you sort of think that they're talking about, people who are living on the street, who are living unhoused, are creating a safety risk for others who are housed and are spending time in the community, walking down the street, getting from one place to another, doing what they do. But this gentleman was sharing with me things that are more about the safety that he was experiencing. The times that he'd been mugged and put in the hospital, he was missing some teeth, and that was from an attack. And he moves around town a lot because he can't stay in any one place because of the safety issues in any given place where he stays for very long. that he runs into that. And that's he gets robbed, right? If he has too much stuff on him, if he carries too many things, then somebody's going to come take what he has. And, another gentleman I saw that we were having dinner one day, in a restaurant that had tables out on the street, just gets shoved away by the people who work there rather than offered something to eat, or a place to be, to rest for a minute, just not even being able to stay close by because something about his demeanor, the way he looked, made people uncomfortable. And I think that's really at the heart of this, is that it makes us uncomfortable. Someone said to me the other day, the reason we're not doing anything about child homelessness is because we can't believe that children are homeless. It makes us uncomfortable to think that people experiencing homelessness, that children are homeless, that anybody experiencing homelessness could be just like me, that
Yep.
they're people, right? The humanity of them makes us so uncomfortable.
Well, and I think that's the other, for me, that's the other kind of, how the executive order says substance abuse and mental illness are the problems. And it's really actually, when I think of, when you look at the data, roughly a quarter of the folks who are homeless are part of families. And what we know is that I was looking at the point in time data at the federal level, and the number of homeless children increased by 33% between 2023 and 2024. And, sure, there may be some emotional trauma that they are experiencing, but these are kids. It's not like, it is not, I think your story is so powerful because it's really the folks who are experiencing homelessness and living on the street are probably way more vulnerable than any of us really understand in terms of safety. They are way more vulnerable to violence and crime than if you and I were to walk down to the shelter. And that's not going to be it, right? It's really unfortunate that is the story they're trying to tell, because that's not the reality that I've experienced at all.
Mm-hmm.
The other thing to me that is always just a part of that notion that the majority of these folks are in our community that are our neighbors. The majority of them are substance abuse or substance abusers or have some sort of mental illness. And in many ways, mental health challenges, substance use is a pocket under oftentimes mental health, right?
Mm-hmm.
So the other thing that this caused me to begin to question, okay, if you really are going to treat this as a compassionate response, what's in your budget for expanding mental health? What's in your budget for expanding substance abuse treatment? What happens, and then I'm like, okay, wait a minute. You just proposed cuts in Medicaid that are like essential for poor families to actually access these treatments. So I'm like, okay, do I look at what you say or do I look at how you behave? And when I look at how you behave, you are not about creating some sort of compassionate care here, because you actually are beginning to take away these services in so many ways. So that made me start thinking about it too. And the other thing that I found out, Beth, when I started looking at civil commitment, is that those civil commitment rules are governed by state law, not federal law. They're governed by state law. So what are we doing? We're having a federal overreach of government power here, right? And I'm like, wait a minute. Aren't you a party that's about limited government? And here, what are you doing? You are using government power to control situations. And so that's a real, I start questioning like behaviors versus words, and behaviors are beginning to speak louder to me.
Yeah. And when we, just to kind of reiterate on the compassionate response language,
Mhm.
right? The most compassionate thing you can do for another human being is to respect their agency,
Right.
is to acknowledge them as a human,
Mhm.
respect their dignity as a human, and to give them choice in their life.
Mhm. Mhm.
And we know that institutionalization is not the answer. We've been there, done that. We undid that because we saw that it was not working, not helpful. And now we're talking about redoing it. And we have to consider as well, what is the cost behind this? There's been research that's shown that the cost of actually putting people in housing is less than the cost that we're currently paying to care for their hospital bills and their health bills and the various other challenges and the institutionalization, right? If we want people off the street, the real answer is that sweet spot between what people get paid and what it costs to live. That's the real answer.
Well, and you also hit on what do people pay and what they live on. You also are dealing with the other issue that's not addressed in this executive order, which is the primary cause of homelessness. And that is there's no affordable housing. That's just right. We cannot find affordable units. And number two, it talks about wasted money. The reality is the housing assistance that's needed is just plain old underfunded, right? You couple a lack of affordable housing with no housing assistance at the individual or organizational level. Guess what? People are going to be homeless.
That's
And
right.
that economic factor is that's just ignored. It's ignored in the cause of homelessness, and it's ignored in the proposed solution in the executive order. And I think that's really important to lift up, is that the economic costs and the economic issues are totally ignored in here.
Well, and that's one of the reasons I wanted to kind of move into this misnomer about evidence-based practice,
Mm-hmm.
right?
Yeah.
And housing first, because housing first was designed around those economic factors, as well as looking at the dignity of individuals. And it's a common sense answer, is getting people into stable housing is the first and foremost thing that you need to do. And if mental health is a challenge, people aren't going to have the capacity to address their mental health challenges until they have some stable place to be. Yeah, go ahead.
And I mean, I have to say, if I were living on the streets, I might want to take a drink or two to like take care of the cold. I mean, right? I
Yeah.
mean, and honestly,
First.
I probably would go crazy. I probably would go crazy. If I were living on the streets.
It's
So I'm
pretty
not convinced that
around.
substance abuse and mental health are the causes of homelessness. I think it certainly complicates those things in individuals. And Beth, this goes back to when you and I started together, and I went and looked at this, and it reminded me of Sam Sabaris, whatever his name, Sam, I can remember Sam. He did the first, now remember, what is evidence-based? Evidence-based is using randomized control trials. Well, Samson Barris used randomized control trials on housing first. And guess what? Number one, it allowed for people to move into housing quicker. So they were not on the street and they were able to stay in housing longer and they were able to get services. All those things were part of those randomized control studies that were done in the US. And that was back in maybe 2000, early 2000s, 2010,
Yeah.
that time of year.
So
Right.
I actually have some stats from 2000 to 2017. The U.S. doubled their funding to programs targeting homelessness among veterans. Right? And during that same time frame, veteran homelessness decreased by 47%.
Well, what do veterans also get besides a house?
I mean,
They have health care.
They get health care.
They have a whole extra amount of supportive services coupled with their housing.
That's right.
And that's all Housing First is. Get them a house and get them services.
And there's a lot of people out there that'll tell you Housing First is housing only. But that's just not true. It's never been what it was. It's never been what it was designed to be. Housing First is just that. First the housing, then the supportive services.
So this makes me too question, okay, you say this is evidence-based, but yet you're throwing out evidence.
The actual evidence.
Right.
Research.
Right. So what's going on here?
What's going on?
What's going on here? And I just am like, okay, you seem to think that you're going to value getting people into substance use treatment and or mental health treatment, but yet you're not going to fund those kinds of programs greater. You think there's evidence-based solutions there, yet the only evidence-based solutions that you talk about are eliminating harm reduction and housing first. You don't talk about the evidence-based models that are available in the mental health world, right? You just assume that that's there. So it feels more and more like all you're trying to do is just round people up, right? I mean, I go back to that involuntary commitment. I mean, like, and are we really going to allow families who are living on the street with their kids? Are we really going to round those families up?
Well, I mean, Stan, we're doing it right now with ICE. So yeah,
right.
We're going to really do that. I mean, since this executive order came out, the president has also taken federal control of the police of Washington, D.C.
Mm-hmm. Yeah.
And, I mean, it's, there is a we're becoming a militarized state if we're not careful.
Mm-hmm.
Right.
Yeah.
We're to be heading in that direction. It's first, it's people who don't have documentation. And at first it's don't let people into this country that don't have documentation and stop them at the border. Don't let them in. And then it's round up everyone here who doesn't have appropriate documentation and ship them back out. And then it's, well, we're not going to look that hard to see what their documentation is. We're going to round them up first and then figure that out later. Because we've heard multiple accounts of people being detained that are citizens of the United States, born and raised here, and that, this is their country. And now we're talking about, well, there's another set of people that we're deeming undesirable at this point. And we're going to round them up and put them in a place where we don't see them anymore. I mean, literally the orders that are going out right now as they clean up the encampments, and I say clean up, I really mean bulldoze. the encampments in DC. The word is they have to get out of DC. They have to get into a shelter or otherwise get out. Where are they going to go? There's not enough shelter. There's nothing
Right.
compassionate about that response.
Yeah, that's true.
There's nothing compassionate about that response.
Yeah. So I feel like we've made our point around what the executive order is and isn't, and where we kind of stand on it. And I want to continue talking about how important it is, particularly for service providers, organizations, and philanthropic folks, and even, quite frankly, local governments, to really kind of think about what your values are and really try to live into those that are really about supporting humans. And but that's as far as I get in my thinking right now, because you're so caught up in the executive order itself and how bad it is, and then I'm like, but we need to start thinking about this. We need to start telling our stories, and we need to start thinking about what our values are, and really live into those values as humans. And that's that's as far as I've gotten in this thinking. You may have gotten a little farther than I have.
Well, I'm thinking if we try to live with integrity in whatever space we're called to be in, or that we feel drawn into, because this is the mission of our organization, or right, this is where this is our sweet spot. This is what we do, right? We may have to rearrange some of what we do because the environment is shifting around us. But there are creative people in this world. Look at what happened when the COVID pandemic hit, and the way faith communities organized, and food pantries couldn't work the way they'd always worked before. So we started actually taking food to people's communities, leaving food boxes on people's doorsteps, and organizing through the faith communities to help mobilize the product to the people that needed it, right? That's just one example of how, when in crisis, people mobilize and creativity grows. If we live into our integrity, and if we live into that value of respecting the dignity. I mean, I grew up in the Episcopal Church, and one of the baptismal vows is literally to respect the dignity of every human being. And we see that every time someone else is baptized in the community. It's a constant that's said over and over again. And it's been running through my mind lately, after, just lately. And that's the one thing that I keep coming back to, is like, that's the value I really want to uphold. How do we actually respect the dignity of every human being?
Yeah.
Yeah.
Yeah. And yeah, that's good.
So for you and me, and for, my neighbor and anybody else down the street, that might mean when you're driving up to a stop sign and you stop and there's a person there with a sign and they're asking you for money, and it feels incredibly uncomfortable, and it might feel a little unsafe, and you're not really sure how to respond. You don't have to do anything that you don't want to do. You don't have to give that person money, but maybe challenge yourself to make eye contact and say hello or nod, right? Be with that person for a few seconds.
Yeah.
It is another human being that is standing next to you, right? That's one little simple thing that we can do. And I challenge anyone to do that multiple times and not feel changed by it.
Yeah.
Yeah. Programmatically and within our programs, we've done a lot of work staying on adaptive models. And I think we need to realize that everything is coming unfrozen. And when things
Yeah.
unfreeze, we might not like the way it unfroze. We might not like what's happening, what this disruption is, but disrupted it is. So there is opportunity to shift.
Yeah, and Beth, I want to go back to that notion of creativity because, I'm not convinced we learned our lesson with COVID to some degree, because what did we try to do? We tried to go back into the very same system, right? The same kind of services, the same. We kind of moved back, tried to get, and you heard the language. Let's get back to normal.
Yeah.
Right. Right. And I think we did. And I think now this is very different. This is like, and I'll say it because it feels very much like this is a very much a, it's not a compassionate place. It's a place of harm. And it feels like there is intentional harm being placed on people who are already vulnerable. And I don't particularly like it. And I don't like the way these institutions are being taken apart. But can we literally let go? The institutions and all its things are being left out. So what do we do in terms of creating new ways of being? Maybe we don't want to repeat. And what's a good example? I don't know that I have a good example, but I keep thinking, I keep thinking, what if HUD goes away, but what it could be recreated in its place that's very community oriented, very state oriented. What could happen if we are getting rid of these bigger institutions and right? If we're getting rid of Housing First, okay, that's fine. But I'm still going to try to get people into housing quickly because I know that works. And our communities know that work. Right? I don't know. That was not well thought out there. But I feel like just our creativity needs to be not our creativity doesn't need to be bound by the old structures. That's what I want to say. We need new structures, new systems. And our tendency is to go back to be creative within that structure, within that system. And these systems and structures are being pulled apart. So that's going to require a different way of thinking and a different kind of creativity that we're not used to, I don't think. Now, I don't know what that has to do with this conversation, other than we really need to step outside. You take this opportunity and step outside the box.
Yeah.
Because number one, people are human, people are smart, people can figure this out.
Right. And that gives me hope. That gives me hope.
Yeah.
And I think that's the other thing is that I would challenge folks. You actually said it to me just before we got on this call, right? But just before we started this conversation, that the system wants us to be paralyzed. The push here is pushing us towards fear and being paralyzed so that we don't know what to do. And we feel like anything that we might do will not be enough or it won't matter. And that shuts us down. That shut down thinking is what that is. And so I think the other thing that I challenge folks to do is to recognize that when they feel it. It's not that you're not going to feel it. You're going to keep feeling it because that's what you're being driven towards.
Mm-hmm.
Right? This is inflammatory language that's used in these executive orders and in the actions that are being taken. They're not only harmful, they're inflammatory. So,
Mm-hmm.
so they hurt now, and then they start a flame to hurt more. And we have to recognize our defensive responses and the responses that are flight, fight, freeze, and the responses that make us shut down and don't allow us to function in ways that are productive and helpful, and the things that shut down our creativity, right? So if we recognize those and set them aside and allow that creativity move, then we can overcome.
Well, and just as you said, because you were like, I don't know if I want to do this, but the minute you started telling the stories, your personal energy shifted into like, oh, this does matter.
It does matter.
Mm-hmm.
This conversation matters.
Yeah.
And we need to keep having these conversations, Stan, you and me and the world, right? Every one of us you have this conversation with people who think like you. And if you dare have this conversation with someone who doesn't think like you, and see where
But, you know, sometimes you just need to have the conversation with people who think like you.
Yeah,
because
that's what I'm saying.
I mean, you
need,
and I both, like, we've both been in down places because of this, right? And here we are. I'm pumped now. This is great. So we'll just have to push the stop recording button and turn this out into the world. And I would invite people to take a look at our website, partnersforimpact.com. We've got resources. We've got a pretty active blog. We've got, you can see who our consulting team is on the website, and all sorts of stuff there that we would encourage you to do that, and or contact Beth or I if you want to continue to have this conversation. And it's our first names, Beth at partnersforimpact.com and Stan at partnersforimpact.com. And Beth, I really just I will say this, I appreciate you kind of playing with this conversation and doing this. I think who knows what will happen, right? But it's been fun to try this, to do this, and to be kind of in this business together. And I appreciate you for that, and thank you for that.